In this portion, we will cover the ossification and the presenting parts of the clavicle. Start with the ossification. As I already told you, the ossification of clavicle is membranocartilaginous. Whole of it ossifies with the membrane except the medial end, which ossifies in the cartilage. It ossifies by 4 ossification centers, 2 primary for the shaft, medial and lateral, which appears 5th to 6th week of intrauterine life and the fuses of 45th day of intrauterine life. Secondary center for the sternal end appear in cartilage at about 18 years. It fuses with the shaft start at about 21 years and completed as late as 31 years. That's why it is the last bone to ossify. And this sternal end is the growing end of the clavicle. The secondary center at the acromial end appears 20 years and fuses immediately, but it is occasionally. Ending parts of the clavicle. It has a sternal or medial end and a acromial or lateral end with an intervening shaft. Medial or sternal end is much enlarged and articulates with the clavicular notch of manubrium sterni and first costal cartilage to form the sternoclavicular joint, and the articular surface covered with the fibrocartilage. Acromial or lateral end is flat and has an oval facet which articulates with a similar facet present on acromion process of scapula to form the acromioclavicular joint. Shaft of clavicle is functionally divided into 2 parts, lateral 1/3 and the medial 2/3. Lateral 1/3, which suspend the scapula by the attachment of strong coracoclavicular ligament, and the cylindrical medial 2/3, which actually transmit the force from the upper limb and act as a strong bone. Important part is the anatomical position and the side determination of the clavicle. We have to put the clavicle horizontally for the side determination, and the anterior concave border at the lateral 1/3, which one is flattened, and the convex anterior border and the medial 2/3, which is rounded, placed anteriorly, and the conoid tubercle and the subclavian groove will be present in the inferior surface and placed like this. This is the left clavicle, here left side of the clavicle, because the concave anterior border placed lateral 1/3 placed anteriorly and the convex anterior border for the medial 2/3 placed anteriorly, and the conoid tubercle and the trapezoid ridge and the subclavian groove placed inferiorly. So this is the anatomical position and the side determination of the clavicle. Attachments of the lateral and medial parts of the clavicle. So first talk about the lateral 1/3. It has an anterior concave border and the posterior convex border, upper subcutaneous surface and the lower surface, which has a conoid tubercle and a trapezoid ridge which extends forward and laterally from the conoid tubercle. If we are talking about the attachments, so the anterior border and the adjoining upper surface give origin to the anterior fibers of deltoid muscle. The posterior convex border and adjoining upper surface receive the insertion of the anterior fiber of trapezius muscle. The conoid tubercle and the trapezoid ridge of lower surface give attachment to the conoid and trapezoid part of coracoclavicular ligament respectively. Then the medial 2/3, it has an anterior, posterior, superior and the inferior surface without any limiting border. Anterior surface gives origin to the pectoralis major in middle half. Between the pectoralis major and deltoid, the clavicle forms the base of the deltopectoral triangle. Then the superior surface gives origin to the clavicular head of sternocleidomastoid in middle 1/3. The gap between the trapezius and sternocleidomastoid forms the base of the posterior triangle of the neck and give attachment to two lamina of investing layer of deep cervical fascia enclosing the supraclavicular space. Actually, in between the four muscles attachment, the entire anterior superior surface of clavicle is palpable and covered by the skin and platysma, and also crossed by three branches of supraclavicular nerve. Sometimes the intermediate branch pierces the bone. The posterior surface, which is smooth and concave, close to the sternal end, it gives origin to the part of sternohyoid muscle. And the rest part of posterior surface related with the internal jugular, subclavian and brachiocephalic vein in the middle part, subclavian artery, trunk of brachial plexus in the lateral part, apex of the lung covered by cervical pleura and suprapleural membrane, and the suprascapular vessels pass laterally along the upper border of this surface. Now the last inferior surface, this surface has a longitudinal groove in the middle 1/3 for attachment of the subclavius muscle, and the two lip of this groove give attachment to the clavipectoral fascia. Close to the sternal end, the inferior surface presents a depression area for the attachment of the costoclavicular ligament. So these are the all parts of the clavicle.